In this video, we will discuss about some of the disease outcome in triple negative breast cancer with activated platelets. As this activated platelets will leads to hypercoagulations or might leads to hypercoagulations at the same time. Along with this hypercoagulation, in the literature it is mentioned that with increased BMI, it might also contribute towards this metastasis behavior of this TNBC. We will discuss whether their hypothesis about this activated platelets towards this metastasis of this triple negative breast cancers is true from the data that is already been published. So first they check the effect on this prothrombin values and this partial thrombin values and thrombin times and this fibronectin. And what they are able to find out in the high fat diet mice compared to the normal diet mice, they do not see a significant difference for prothrombins and thrombin time formations and the fibronectin formations, but they see a decrease in the this partial thrombins formations, which they call it as PTT values. And thereafter they check the effect of this PTT with the BMI, as BMI might cause these hypercoagulations and it might leads to this partial thrombin formations. They wanted to check whether this increased BMI has a impact on this APTT, or that is partial thrombins, or not. And what they are able to find out is that with increase in the BMI, there is a decrease in the APTT values, but to a moderate extent, not very significantly. So it shows that there is some relationship with increased BMI to this decrease in the APTT, partial thrombin formations. Next, they check the survival rate for different conditions. So first, in the panel F, they check the survival rates in the HFD mice conditions with in the quartile 1 for this APTT. And for this APTT, they are able to find out the patients that have this reduced APTT has lower survival rate, around 8.9 years, has lower time period for the reoccurrence of the cancer, like around 8.9 years, whereas for the case where APTTs are present in the normal amount, that is quartile 2 to 3 4, they see average time for relapse of this cancer is around 11 years. So this indicates that APTT will reduce the relapsing time. Thereafter, they also check for this prothrombins cases. They do not see a significant difference for the survival rate or relapsing of the tumors in these prothrombin cases. And similar results they have seen for INR and for the fibronectins, that there is no significant difference between quantile 1 and quantile 2, 3, 4 survival rate for the INR and for the fibronectin. The p values are greater than 0.05, whereas in the case of panel F, we can see the p values are less than 0.05. So in summary, what they are able to conclude that the disease outcome in the triple negative breast cancer cells can be related to the hypercoagulations of the platelet, and to some extent it can also be related to the increased BMI. So this altogether, they conclude that from the previous videos they find out that in the high fat diet conditions there is more platelets formations, and that might cause this high fibronectin expressions on the endothelial cells, which will cause increased interactions of the tumors and endothelial cells, and the platelets, that helps in the metastasis of the tumor cells. And in this video we have discussed we have analyzed some of the published data about the impact of these hypercoagulations or the activated platelets indirectly on this disease outcome of this triple negative breast cancer cells, which is one of the highly metastatic conditions of the breast cancer. And they are able to conclude that if the high BMI or the low partial thrombins might give some indications towards this triple negative breast cancer's progressions. If you need to understand more about their experiments in detail, you can go through the reference that has been provided in the description. That's all for this video. Thank you for your time.